Hi, I'm Dr. Malpani, and today I'm going to talk about what you as a patient can do to make sure that you get the best possible medical care. I think we all agree that everyone is concerned about the state of the healthcare system in India, and everyone believes that the commonest problem is that there is a shortage of doctors, that because we don't have enough doctors, that's why patients aren't able to get the right medical care. I actually think that's wrong. I don't think there's a shortage of doctors. I think there's a shortage of well-informed patients. And let me explain to you why. No matter how many doctors you create, you will have good doctors and you will have bad doctors. And the bad doctors can be a real problem. Trust me about that. And obviously, the more the doctors, the more the bad doctors you have. And it's not just a simple question of quantity of doctors, it's also a question of distribution. And the trouble, of course, is that all the doctors collect around the large metropolis cities. You have too many doctors in places like Mumbai and not enough doctors in the villages. So, what can we do to address that issue? And rather than complain about things which are not in our control, let's focus on what is in our control. And one of the things in our control is to be a well-informed patient. And that's what I'm going to focus on. But before we talk about solutions, let's talk about the problem. Let's make a diagnosis. And there's no question about the fact that patients today are unhappy with doctors. I'm a second generation doctor. My parents were doctors too, and they were held in high regard. Today, unfortunately, that entire high regard is gone. There's a huge trust deficit between doctors and patients. Doctors are seen as being commercial, uncaring, doing unnecessary tests and operations just for the sake of money. They make patients wait for hours on end. They talk down to patients. They're not respectful. They don't listen to patients. And pretty much patients are dissatisfied. Now, fortunately, by the grace of God, most things go well when you go to a doctor, so everything's fine. But it's when things don't go well, that's when patients get angry and doctors get beaten up and hospitals get burned down. And that's a big tragedy for everyone. And partly because of this entire issue of commercialization of medicine and the corporatization of medicine, there's no question that medical care has also become very expensive. And doctors are seen as being too money-minded, too commercial, too uncaring, because it seems like they're putting profits before patients. And everyone talks about the old family doctor of the past who would spend time and know your name and the name of your daughter and the name of your grandchildren, and that doctor has just gone away because everyone has got siloed, everyone's become specialists. But you know what? It's not just patients who are unhappy with doctors. Doctors are unhappy with patients as well. Today, most patients think of themselves as consumers. They doctor shop. They do a 10-minute search in Google and think they've become experts. And therefore, they challenge the doctors. They're quite rude sometimes. Doctors feel unappreciated. They feel bullied by the media because no one ever says anything nice when the patient does well, but if the patient doesn't do well, it's always the doctor to blame. And this is true not just for the press, which always flashes on the first page anything which goes wrong, but it's true for the judiciary as well. Even judges, for example, seem to be allergic to doctors. And whenever there is a problem, the first thought is, oh, the doctor was negligent. The doctor must have done some malpractice. That's why things went wrong. And today, doctors feel unappreciated. And quite frankly, they feel overworked, they feel underpaid, they feel, I've spent all my years training to become a doctor. I have no family life. I spent all my time in hospital looking after patients. I'm on call all the time and patients don't care about me. So what's the result of this? Everyone suffers. Doctors are unhappy, patients are unhappy, doctors go on strike. And the tragedy is that no doctor wants their children to become doctors anymore because they think their life is just full of hard work with no appreciation whatsoever. But I think we need to remember that both doctors and patients are on the same side. We're on the patient side because don't forget, medicine is a service profession. Doctors became doctors because they like helping patients. They want them to get better. They like taking care of them. So the question is then, how can we create a win-win situation? And one thing I'm very clear about, one of the reasons I don't talk to doctors is good doctors, and most doctors are good, don't need to be told anything. They will always do what's right for the patient because they're professionals, they have a sense of ethics, they have a fiduciary responsibility. And the bad doctors, no matter what you tell them, they're not going to improve. So there's really no point in talking to doctors. So let's focus on patients. And this is where the concept of information therapy comes in. And this goes well beyond whether it's homeopathy, Ayurveda, allopathy, or whatever else. And what is information therapy? Information therapy is powerful medicine because it's the right information for the right patient at the right time in terms which he can understand. The reality is that if we can empower patients with information, we can help them to identify the right doctors so that they can form a partnership, so that you then have a good patient with a good doctor, and that's a perfect combination. And honestly, patients are the largest untapped healthcare resource. Unfortunately, in India, we don't have a shortage of patients. So let's focus on educating them and helping them to understand what they need to do to become good patients. I think a lot of patients are very intimidated by the idea of, oh, what do I understand? I never understood biology. My doctor is an expert. And I think that's wrong. You're smart. Don't underestimate your abilities. We're not teaching you how to do an operation. We're not telling you to do an appendicectomy. We're just telling you it's your disease, it's your body. Take an intelligent interest in what's happening to you. And today, thanks to the internet, there's so much reliable information available that you can empower yourself with this before you go to the doctor, after you go to the doctor. So you can ask your doctor intelligent questions and make sure that he provides you with intelligent answers. Remember, knowledge is power. Your doctor is your partner, but he's not a mind reader. He doesn't understand what's happening inside unless you speak up. And if you get the confidence with information therapy to speak up, you will be happy, and trust me, good doctors will always be happy. Why does information therapy help so much? First, it helps with self-care. Remember, most problems, headaches, coughs, colds, fevers, are self-limited. They're going to get better on their own. We don't need to go running to a doctor for a lot of this stuff. And if things get better on their own, then, there is no need to spend money on that doctor visit. But that doesn't mean that every headache is benign or you can fix everything for yourself. And information therapy will help you identify when you can do things for yourself and when you need to go to your doctor. So you don't need to become excessively dependent on going to a doctor. We don't want you to become hypochondriacs, remember that. Equally important, I think information therapy provides you with what are called evidence-based guidelines, so that you can ask for the right medical treatment, no less and no more. And this is quite a problem today, when doctors are very keen on doing all kinds of tests and all kinds of surgical operations, which are not always in the patient's best interests. So you can't just go by eminence-based medicine or expert-based medicine based on the doctor's personal opinion. Evidence-based medicines means there are guidelines laid down. These have been proven by controlled clinical trials to be helpful. That's what good doctors follow, and that's what you as a patient should insist that your doctor follow as well. And finally, information therapy empowers you with veto power, which means you can say no to unnecessary tests and no to unnecessary surgery, which, trust me, is very good for you because it will end up saving you a lot of money. It's not just that we're trying to help patients to talk to doctors. It's also equally important that doctors learn how to talk to patients, and information therapy does that. And I, as a doctor, have been practicing now for over 30 years, can tell you I learn a lot from my patients. If you treat patients with respect, they respect you back. And a lot of times patients, I use them as unpaid research assistants. I said, look, there's lots of information, go hunt it out. Have questions, come back to me, I'll explain to you. Together we can learn more. The good thing is well-informed patients have realistic expectations. They know that doctors are not miracle workers, we're not magicians. They know what we can do and they know equally what we can't do. And I honestly believe that just like doctors get the patients they deserve, patients get the doctors they deserve too. And the reason that's important is because sometimes the problem is not with you as a patient. Sometimes the problem is with the doctor. There are difficult doctors out there. There are arrogant doctors. There are doctors who don't respect patients. There are doctors who enjoy making patients wait. They actually put the doctor on a pedestal. That's what the doctor feels. And he actually puts the patient down below saying, oh, you won't understand what I'm saying. They deliberately use jargon, complicated words, and they're offensive. And they say, if you're going to ask me questions, please go somewhere else. Don't ask me. Which I can't understand. No doctor in this world can guarantee 100% good outcome no matter what he's doing. And part of a doctor's job description is to educate and teach patients. And I think it's your right as a patient to demand this, just like it's the doctor's responsibility. And the doctor should respect you. And if you don't understand something, it's not your fault, it's the doctor's fault. He's not explaining well. I think, remember one thing, the quality of your doctor's answers do depend on the quality of your questions. And the more the questions you can answer for yourself online, the easier it will be for you. And we think there's a simple formula for this, and the formula is called SAFE. We're teaching you how to talk to your doctor safely. What does SAFE mean? SAFE is an acronym, where S is your story. You tell the doctor exactly what happens to you. 80% of the time, a good doctor can actually make a diagnosis based on your story. When did this start? When were you last well? What makes it better? What makes it worse? What have you tried before? Tell an accurate story. It's a good idea to write everything down so that you don't forget stuff and you can actually share that with your doctor. After S for story, there is A for assessment. Assessment is your assessment. Now, I'm not telling you make the diagnosis for yourself. You tell the doctor what you think the problem. Is it related to stress? Is it related to your diet? And usually patients have a fairly good idea of their own bodies and what's happening to them. F is your fears. What are your anxieties? And sometimes, we can all be irrational. And for example, if you hear that someone just died of COVID, you have a cough, you start worrying, oh God, do I have COVID or not? And that's why you should tell your doctor, this is what I am concerned about, so he can reassure you. And finally, after S for story, A for assessment, F for fear, comes E for expectations. What do you expect your doctor to do? Do you just want him to reassure you? Is verbal reassurance enough? Do you want him to run some tests for the reassurance? Do you want him to do additional things for you? Remember, doctors aren't mind readers. If you tell us what you want, we'll do our best to help. It's important that you do your homework because a doctor's time is precious. And that's what the internet is great for. Now, the internet doesn't make you a doctor, and the trouble with Google is there's lots of rubbish and lots of information. So you need to become a sophisticated patient to find out. So don't just believe everything which you read on a website. Internet searches can be misleading, they can be commercial, they can be outdated, they may provide the wrong information. And that's why doctors often get upset by what they call Google positive patients who think they know everything, but they know all the wrong stuff. And sometimes it's important to ask the doctor, hey, tell me which websites are useful. And in fact, the best doctors will provide website addresses to their patients, and the even better doctors will actually create their own websites and prescribe information therapy. Because remember, you trust your doctor, so that if your doctor creates a website, of course you will trust that information on the website because he's created it for you and you have that personal relationship. I think information therapy is just going to continue to grow. I wish health insurance companies provided. I provide that the government should provide it so that it's easily available. And today, with a mobile in your hand, if you can get trusted sources of information, this is going to make your life so much easier and the doctor's life so much easier. You are going to have lots of questions. I'm more than happy to answer them. All I want to emphasize is, just like there are good doctors and good patients, there are bad doctors and bad patients, and it's a combination which matters. If you are a good patient and you find a good doctor, you're sorted. You really don't need to worry. You don't even need to listen to me. If you're a good patient, you can make sure that if by misfortune you end up in a bad doctor's hands, you can stay away from him or you can move on to a good doctor. If you're a bad patient and you're lucky and you get into a good doctor's hands, then you're fine. But if you're a bad patient and you end up with a bad doctor, your life is going to be pretty miserable. And that's why we keep on emphasizing, you can't leave everything up to God. You can't leave everything up to your doctor either. Make sure that you prescribe information therapy. And the good thing is, it's a free prescription. It's a self-prescription. And the more you know about the problem, the better for you and the better for your doctor.